joining us here, those who are joining us online, ladies and gentlemen, my sincere and profound welcome to today's press conference. We are deeply grateful that you found time to join us today and that from your busy, demanding schedule. Your very presence here today is very, very much appreciated, and you recognize and underscores the profound importance of the matters that we are addressing today. This is a gathering that signifies both faith and information coming together for the public good. We recognize that the media plays a vital role in addressing accurate, responsible, and timely information, especially when it comes to concerns that touches the welfare of the communities that we serve, and in particular, the health advocacy issues that we are addressing today. We are honored that here today we'll speak directly to the public through you. We are gathered here not merely to make an announcement, but to call upon, but to deliver a unified statement, which is a message, which is one faith, one voice, and our shared commitment to health and wholeness in Africa. This is a statement from Christian faith and health leaders in Africa that transcends our individual organizational boundaries and addresses our shared society concern. So today's press conference will outline our shared calling, our shared concern, our conviction, our commitment, our call to action, and our call to action, and also our closing affirmation, which is a unity statement. So as we begin, we are going to begin with reading the statement, and it's going to be followed by a brief opportunity for questions and answers. We kindly request that all questions be directed through our moderator to ensure that we maintain the respect and decorum appropriate for this gathering, and that we stick to the content of the press media toolkit and the information that is contained there. Those who are online, you are free to write your question on the chat box, and our technical team is going to gather those questions and will forward so that you're able to respond to them at the appropriate time. Thank you. So thank you once again for honoring our presence. It is now my distinguished privilege and honor to transition the floor to our distinguished speakers, who I'm going to introduce to you in the order that they're going to be speaking. And the first speaker will be Reverend Francis Mkandawire. He comes from the Evangelical Association of Malawi. The second speaker is Mrs. Joyce Khayiyi. She's representing the All Africa Youth Network, and she comes from the Anglican Church of Uganda. We have Bishop Matthew Hassan Kukah. He comes from the Catholic Diocese of Nigeria. And our last speaker is going to be Archbishop Alex Geza Malalusa from the Evangelical Church in Tanzania. Welcome, Reverend Francis Mkandawire. Take over the floor.
Thank you so much. We'll read a statement from Christian faith health leaders in Africa titled One Faith, One Voice, a shared commitment to health and wholeness in Africa, which is being issued on the 27th November 2025. A guiding verse, John 10, verse 10. I have come that they may have life and have it in full. Okay. So this is the statement from Christian faith and health leaders in Africa, titled One Faith, One Voice, a shared commitment to health and wholeness in Africa. issued on the 27th of November 2025. Our guiding verse is John 10, verse 10. I have come that they may have life and have it in full. One preamble. Our shared calling. We Christian faith and health leaders from sub-Saharan Africa gathered in Nairobi, Kenya from the 25th to 27th November 2025 to discuss human health needs. Out of concern for the health situation in Africa, we affirm that promoting holistic health is a sacred expression of faith and a central calling of the church. We represent a broad Christian fellowship united by faith in Christ and a shared mission to serve communities across Africa. Together with our global partners, we affirm that caring for the sick, protecting people's health, and advocating for justice are not peripheral acts of discretionary charity. They are mandates of discipleship and foundational expressions of Christian fidelity. Number two, our shared concern. Lives at risk, a moral crisis is unfolding. Proverbs 31 verse 8 says, speak for those who cannot speak for themselves, for the rights of all who are destitute. Faith-based networks coordinate health care across more than 14,000 health facilities, representing 30 to 70 of health care, depending on sub-Saharan country, plus extensive programs that reach across urban and rural communities, irrespective of religion, ethnicity, or socio-economic status. These are trusted partners with national systems. Health is a public trust and a shared responsibility. We urge governments to sustain funding to the front lines of care, to work with all sectors, including faith communities, so that no family is left without essential services. This includes faith-based partnerships. I'll now ask my colleague to, yes, thank you.
So across our continent, health systems are straining under growing need and shrinking resources. Official development assistance, which is declining, has increased vulnerability across health systems. So access to services and commodities among those in need has reduced. As a result, lives are being threatened and lost. Health facilities run out of health products and technologies. Health workers go unpaid, and preventable deaths are rising. So we face a crisis shaped by 8 urgent pressures. One is the dwindling international support for essential programs. Across our continent, funding cuts for HIV, tuberculosis, and malaria programs are weakening prevention and community care, putting families and congregations at risk once again. The second, rising mortality from preventable diseases, for example, malaria, once in retreat, is now resurging. Current projections warn of additional deaths in the coming years without renewed investment. 3 is the rapid population growth and urbanization. Africa's population is young and expanding fast. With the youth majority increasing in every country, urban growth outpaces the development of systems for primary health care. The fourth, overlooked adolescents. Today's adolescents are navigating rising mental health challenges, early pregnancy, unemployment, substance abuse, and social pressures intensified by digital and urban change, fostering silence and despair. Churches and health systems are often the first to see these struggles, but are not yet equipped to respond with coordinated care. The fifth, heightened vulnerability to outbreaks and pandemics. Cholera, Ebola, COVID-19, and other threats reveal gaps in preparedness, surveillance, and local response capacity. The sixth is antimicrobial resistance. AMR reduces the effectiveness of treatments. These challenges threaten global health security. The seventh, non-communicable diseases, the NCDs, diabetes, hypertension, mental illness, and cancer are creating crises in homes, families, congregations, and health systems. The eighth is conflict. Regional strife and other conflict issues causes injury and trauma and forces the displacement of entire populations. These overwhelm health services. So this is not only a health crisis, it is an ethical and moral crisis. We are compelled to speak when human lives are devalued and systems of care falter. I'll invite Bishop.
We, as Christian leaders, are convinced that the provision of health is a spiritual mandate, because our Lord Jesus Christ said, as you go, proclaim this message. The kingdom of heaven has come near. Heal the sick, raise the dead, cleanse those who have leprosy, drive out demons. Freely you have received, freely give. We believe that healing was central to the ministry of Jesus. The church's mission extends to the physical, emotional, spiritual well-being of all people, and therefore provision for health, one's own and that of others, is a spiritual mandate rooted in the love of neighbor and the pursuit of wholeness. We as faith leaders are therefore advocates for health and wholeness, whose voices reach into hearts, homes, congregations, and communities. We believe that as faith leaders, when we speak about health, we lend moral authority to our actions. We build trust in communities that depend on our institutions. We promote compassion, address stigma, and help people seek care. We seek partnerships with our governments and governments around the world. We call upon Christian leaders elsewhere to speak courageously about health from the pulpit and also in public life, addressing issues such as maternal and child health, mental health and substance abuse, HIV, NCDs, adolescent health, pandemic preparedness, among many other parts of health, as part of the church's witness to life and dignity. We as religious leaders have a commitment, one of partnership between faith and systems. We affirm that we are one faith with many gifts, that when we speak together, we magnify the witness of Christ's love. We therefore have committed ourselves to, among other things, one, advocate jointly for health as a moral, spiritual priority in every nation around the world, but in particular Africa. Two, to strengthen collaboration between church networks, the private sector, and government institutions in our different countries. To communicate hope and accurate health information through our trusted faith channels and other avenues that are available to promote sustainable, locally led financial models and governance of health systems. Fifth, to seek financial and other capacity strengthening partnerships with bilateral and multilateral partners. Sixth, to stand together, Christian faith and health leaders, as one witness to justice, compassion, and healing in our communities, to ensure access and analysis of data to influence decision-making for sustainable health systems, to enhance follow-up and assessment, to put into place monitoring mechanisms of health and partnerships, to emphasize prevention and promotion through health systems, through health education, hygiene, and vaccination, to address misinformation, misleading theologies and myths on health issues, and finally, to address inequities in healthcare access among our people. I now yield the floor to Archbishop Alex Malalusa.
Our call to action: one faith, one voice. Our guided verse is from Philippians chapter 2, verse 2, which says, "Then make my joy complete by being like-minded, having the same love, being one in spirit and one in mind." Relationships come before request, but also trust must be built before advocacy begins. We must invest in channels that connect faith and health community networks, media, platforms, and national councils so that our shared message of healing is heard clearly. We commit ourselves as faith and health leaders to deepen collaboration with our national governments, private sector, and international partners so that every person, especially the poor and the marginalized, can access quality health services. We call upon governments and parliaments to prioritize equitable and sustained investment in the health system that serve all citizens, progressing to meet the Abuja Declaration of 15% of their budgets. We call upon National Ministry of Health to engage faith-based communities, including provider and religious leader and integral partner in planning, financing, and evaluating national health goals. We call upon international development partners, global institutions, the private sector, and local partners to maintain predictable support that strengthens national system and leverage this trusted role of faith-based networks while respecting local organization values. We call upon churches and health associations to mobilize local resources and to model transparency, accountability, and stewardship in the use of resources. And in our closing affirmation, we are concluding by reading from Proverbs chapter 3, verse 27 to 28, which says, "Do not withhold good from those to whom it is due when it is in your power to act. Do not say to your neighbor, 'Come back tomorrow and I'll give it to you,' when you already have it with you." End of quotation. Disease knows no borders or biases, and our response as faith communities must be just, expansive, united, compassionate, and without hesitation. We stand together, Christian faith leader and health leaders, as one fellowship committed to healing and hope in time of scarcity and division. We choose unity, stewardship, and love of neighbors. This statement was released publicly at the press conference here in Nairobi on 27th November in 2025 as unified voice to our governments, regional bodies, and global partners. And it is signed by senior clergy and health leaders from Cameroon, the Democratic Republic of Congo, Ghana, Kenya, Nigeria, Malawi, Rwanda, Uganda, Tanzania, and Zambia. Thank you for listening.
Thank you. Thank you very much, our distinguished religious leaders, speaking on behalf of the members from the 10 countries represented here. At this juncture, we are going to open the floor for questions from the media. We have one here, and we have the technical team give you the mic so that you're able to ask your question.
Thank you very much. My name is Sarah Jerving. I'm a journalist with DevX. Under the U.S. State Department's new America First Global Health Strategy, there is an emphasis on deepening relationships with faith-based organizations. The State Department currently has teams going around from country to country, negotiating bilateral health agreements with countries. I'm wondering if any of you have been brought into these conversations, and if you could talk a little bit about that. Are you being asked to kind of pitch proposals around these bilateral health agreements? And kind of more broadly, do you see this as, or kind of what sort of opportunities do you see in terms of deepening your relationship with the U.S. government and U.S. financing? Thank you.
Thank you. Thank you very much. Question? Any other question, or we take that one first? And we are going to request our co-host to respond to that question. Nkatha or Doug? Okay.
Yes, I have a question. My name is Fred Zwili, writing for Religion News Service and others. My question is, how are you impacted by the changes in the US, and how are you responding? Can someone quantify to me the impact of that on the grassroots?
Thank you. Thank you very much. Let's take those two questions first.
My name is Nkatha Njero. I am the CEO of the, sorry, let me answer from this. My name is Nkatha Njero. I am the CEO of the Africa Christian Health Associations platform, a platform that represents the faith-based health actors in sub-Saharan Africa from 43 organizations in 30 countries in sub-Saharan Africa. We have been involved in conversations with the US government, and just to state that, yes, have been people that offer, or organizations that offer as faith sector 30 to 70% of healthcare around the continent, we have been impacted by the cuts. And the impact includes on our health workers, on service delivery for HIV, for tuberculosis, for malaria. I can provide you with figures in places where we have been able to quantify this. We have patients who have had, we have patients who've been receiving care that now have to seek care in places where probably there are, where the health workers are no longer available in the quantities they were, and therefore impacting that. We also have impact to supply chain in many areas as well. And also, we continue to feel impact to community programming as well, where services that were available to people in the community are no longer available. And we have been involved with the State Department in many countries. Many of our countries have been asked to join conversations. As you're aware, these conversations are with our governments. The faith sector has been called in. One of the things that we have been continuously saying is that whereas the faith sector is being called to these conversations, it is important to recognize the role that the faith sector plays and to substantially engage them and also support them. We recognize that our governments have a lot of priorities. That may mean that prioritizing the service delivery by the faith sector might not be feasible. And therefore, our plea to the State Department of the US government is that they continue to engage the faith sector substantially so that we can help our specific governments to continue providing healthcare to our citizens. And in all conversations that we have been in, we have been emphasizing that. In some countries, conversations are continuing. In some countries, conversations are at advanced stages. Our plea is being heard in some countries, but in other countries, we still need to continue to talk to both our governments and the State Department to understand why the faith sector needs to be engaged substantially. Thank you very much.
Thank you. Thank you very much, Katha. Any other question from the floor before we go online? We also have questions from our online media personnel. We have a question there at the back. Your name and the media house you represent.
Good morning. Yes, my name is Jael Chemtai. I'm a journalist from KBC. So my question is, how can we look within as African countries so that we can fill in the gap that, that we are facing now that there is financial cuts in the health sector? I'm asking this question because we really need to, look within and as a country, or rather as a continent, so that we do not suffer the same fate twice. Yeah. And then my next question would be, one of the agendas was suggesting sustainable, locally led health solutions. So from your end, what are these, locally led health solutions that you have so that you can suggest for maybe the health sector or the country can adopt?
Thank you very much, Jael. There's another question there. We take those two before we hand over to our panelists to respond. Your name and the media house you represent.
Thank you, Alan Andeva. Alan Andeva, I'm a journalist from Caption TV. Caption TV is a Catholic-based television here in Kenya. I've got two questions. Missionaries sponsor church projects, but now they are nowhere. The government owes huge debt running to billions. This can say is a fail to assist the faith-based hospital. What is your take on the same? This is very, very important because, for example, the faith-based organization are suffering close to 10 billion. So I'd like to hear your opinion on the same. And there's another hot issue here. I would like to hear your opinion on this hot issue, especially from religious leaders. We have got extreme faith beliefs that are destroying lives in Africa. Even in Kenya, we had issues of Shakahola in Malindi. Also in Western Kenya, we have got issues where patients are forced to believe in prayers rather than seeking professional medication or both. What's your take on the same? I'd like to hear your opinion on the same. Thank you very much. God bless you.
Thank you. Thank you very much. And let me answer the last question, especially being here at the All Africa Conference of Churches. You understand that at the All Africa Conference of Churches, since 2019, we have been addressing the issue of misleading theologies. And your last question actually is touching on the topic that we've been discussing and covering here. We have been creating a lot of awareness among our churches. We have volumes of publications, especially on issues of misleading theology, and we'll be able to share, especially from our membership on what the AACC is doing, especially to address misleading theologies. I'm going to hand over to the panelists, especially our bishops, so that they can answer and respond to the questions asked by Jael. We start with Archbishop Alex Malalusa from Tanzania.
Yeah, thank you for your questions. And I would like to respond that when faith-based or when church leaders are engaging in health services, it's not only business, it's not only services, but it's obligation. And as you witness in several countries in Africa, faith-based hospital and health sectors are really targeting mostly to the poor people and marginalized who can't afford paying. And this is what we are really engaged in doing that. So it's really a challenging, especially when we are discussing about how we can sustain these services. That's why we're inviting others to join us in Africa. So as those who are forgotten, they can also enjoy these services which are provided by the churches. Thank you. That is part of my question, and my colleague will continue with another part. Sure.
I thought the responses were voluntary, but I've been conscripted. Well, I come from Nigeria, so that means there is a problem. We are waiting for Trump, who said he was coming to Nigeria with guns blazing. And that's the last time we heard about Trump. So if you ask other questions, we have no answers. But I think given that the midterm elections are just 6 months away in the United States of America, I think we should be a little bit more modest and come back to a question that I think somebody raised. Namely, what are we doing in Africa? The Thabo Mbeki report on illicit financial flows out of Africa has revealed staggering figures of monies that our politicians and businessmen are sending to Europe. And I think that somebody mentioned the Abuja declaration. I think what we should be spending, and the two things are not mutually exclusive. Namely, while we are having this conversation, there needs to be a much more aggressive and a program decision to hold the feet of our politicians to the fire. Because there's a lot that can be done. I don't think the churches were there when the politicians committed themselves to 15% of their GDP that are supposed to be committed to health. So I think going forward, we also need to pay attention. And I think that's why perhaps one of the things that other civil society groups should also be doing, because the church is always a little bit weak in terms of the capacity to acquire the information, the data, and so on. But there needs to be greater collaboration because the church has only a moral voice that it can add. But I think that on issues of what you call, is it misleading gospel? What did you call? Misleading theology. Again, we are blaming the victim, okay? It is not a question of these people it is that God has become the only solution to the helplessness in Africa. It ought not to be so. So you go to a hospital in Nigeria and many parts of our countries, you have to call back on God because you can, I mean, even on my phone as I've been here, I'm receiving calls from people. I have a young man who is a cripple. He called to tell me his father had just gotten into hospital and asking me to help him pay the bills. I barely sent him my contribution when the second text came to say that his son has just gone into hospital. He's a cripple. He hasn't gotten a job yet. He's gotten a job quite all right, but he's starting the job in about a month's time. So we need to realize that our people are grappling with serious issues, that their decision to go to other ways or seeking solutions by other means is really the default. The real issue is that elsewhere, things can and should be different. So I think that the statement we've made here says quite eloquently that we as church leaders are prepared to walk lock and step with you in improving the quality of the lives of our people. But as you know, and I think that we need to evolve new strategies. There are people who are stupendously rich. Can they put the churches, are we engaging them to put the church's interest in their will? Or what do people do with all these huge resources? We are every weekend sponsoring huge weddings, huge funerals. It is more expensive to die in Africa than to stay alive. When you look at how much resources are committed to funerals. So I think we can, so really what I'm saying by a pretty long road is to say, maybe we need to start pushing a little bit the boundaries as far as local resources are concerned, because they are here and we don't have to wait until the taps are finally locked in Europe and America. So we appreciate this cooperation, but it shouldn't be an excuse for us not doing the things we need to do in Africa. Thank you.
Thank you. Thank you very much, Bishop Kukah. And I'm going to invite Reverend Francis Mkandawire from Malawi. He's going to share with you, especially the sustainable locally led interventions. And we have very good examples in the house here that he can share. Welcome.
Since we have a lot of our technical people here from the Christian health associations, I would want possibly the sustainable solutions, health solutions. I think Zambia, you are here. I think it would be good to hear from Zambia and possibly Malawi. Yes, but I just wanted to add on what a bishop has mentioned, KBC. You were trying to find out in terms of the local resources. Yes, I think one of the things that we've really come to agree on is to say we cannot continue with business as usual. We need to begin to raise resources in our own countries to fill up the gap. I think that all of us have consensus, and we're saying our over dependence on our colleagues who appreciate their support, but somehow there's fatigue out there, and it's affecting us already. That's why we're here. I think we are saying that we need to begin to raise resources locally. And my brother has already mentioned on the need to engage our governments to give more. The 15% Abuja declaration, I think we'll push on that. I think it's important that our governments are moving progressively towards that. But besides that, we need to create an awareness to our people that when it comes to health care, it's our responsibility as nationals. We need to make sure that we help our people. Let's not abandon that to foreigners per se, in terms of. So we want to own that. And therefore, we want to engage the private sector, as has already been alluded to by my colleague there. We want to do much more to raise resources locally, create an awareness of the impact of this on the health sector, especially in the rural areas. So we will be moving towards that. We hope within the next few years or so, we should be able to raise more resources locally to finance our health services. Now, when it comes to sustainable local health solutions, can we hear from our technical people, experiences in Zambia? Possibly you may have some. Yes, thank you.
Ago. Also, I need to move. Okay, so what we're doing in Zambia, some 10 years, 15 years ago, even as far back as 20 years ago, we impressed upon our church health facilities to start some income generation activities. And now we had a seed fund to give them, and that seed fund was a merry-go-round. It meant that if they borrowed from the secretariat, when they give it back, we would give it to another facility. And most of our facilities built small guest houses so that when people are going to those facilities who are coming from far and can afford, they can pay a little sum, which will go to helping the administration. But at the secretariat level, what we began to do is engage the private sector. Right now, we are working with the Zambia breweries. You know that Zambia breweries is a big industry in Zambia. So we've been working with them on some projects, particularly on projects that include youth and alcohol abuse. We've also we are working with Standard Chartered Stanbic Bank Zambia Limited. And we are working with them. They've given us money to build mother waiting home at health facilities, selected health facilities, so that mothers who live far away, 50 kilometers or 50 miles away from facility, can come and give birth at home, at the hospital, but they would wait at the hospital for that time to come so that they're attended to by trained personnel. The other thing we're doing as the Secretariat, we are a recipient of the Global Fund, and we've been a recipient of the Global Fund for 22 years now. Suffice to mention that with the Global Fund, you have to be accountable and transparent. And so we subgrant to other civil society and faith-based organizations. Over the years, we have subgranted to more than 500 sub-recipients. But at the Secretariat, what we did is that we have a new building, an office building, and on the third floor, it's for rent, so that we are generating money that will help in running the Secretariat. We also built another building, not with the Global Fund money, I need to make it very clear, with our own money, because we sold buildings and built another one, and we made sure that the third floor then is out for lease, so we can make it. And we have other projects that are in the making that we hope that we can make money. But I think the message to take home is we need to look in country and look at those private sector. Some of them are making money. We need to make them be responsible. What is their corporate social responsibility? How can they help us? Even just twinning with one of the facilities or two, that would help. We don't always have to look abroad. There was another question, I think, that was raised. How has the cut impacted us? For us who are implementing large-scale programs, for example, the cut, we were affected because we buy ARVs and distribute them to mission hospitals, and we also buy antimalarials and we distribute them to 700 hospitals, including government, in 3 of the provinces. So what that cut did is that for ARVs, we had about $79 million. $9 million was cut. And for malaria, we had about more than $24 million, and that too, a sum was cut. What that meant is that in terms of the essentials like drugs, life-threatening activities were not cut. But what was cut was the community-led activities, and that there is a problem. When you cut community-led activities, you can't expect to achieve much because you need to mobilize communities toward treatment. We have treatment adherence, particularly in the adolescent who are becoming tired. Some of them are actually saying, why me? And these will be the adolescents who were born with HIV infection. And they're saying, it's not my fault. Why is it that I'm taking? And some of them drop out. So you need those community-led activities so that you are mobilized and you are making sure that there's treatment adherence. Thank you.
Thank you. Thank you very much for those responses. We are going to go online. We appreciate our journalists who are following us online. And there are two questions that have been posed, which I'm going to read for the panelists. And we believe that they're going to be able to answer. Some have partially been answered when they were responding to the questions on issues of sustainability. But there's a question here from Malawi, from a journalist in Malawi, and he's asking about the consistency, especially of this ecumenical engagement, and whether we are not competing with the government, and how seriously committed we are to realize these beyond this conference. That's the first question that has been posed. Then we have another question that is being posed. This one is coming from a journalist in Tanzania. And he's asking about Archbishop Alex Malalusa. Actually, this one is directed to you, about pandemics and how we plan to harmonize continental response strategies, especially in areas of pool procurement for essential medicine, cross-border disease surveillance, and even the mobility of health workers. I will invite Reverend Francis first to respond to the one from Malawi, and then Archbishop Alex Malalusa.
Well, I would like to possibly just make it clear that we are not in competition with the government, but complementing the government. And I think that's in all our countries where our Christian health programs, we are really complementing the government, and government relies on us. We rely on them. We are partners, not competing. Yes, I think so. He can be assured that that's okay. In terms of consistency, in terms of ecumenism, working together as various, I think we would say in most of the nations, the countries, for instance, Malawi, we have the various religious mother bodies working together. Like in CHAM has the Catholics and also has the Protestants working together. So right from the top down to grassroots level, we are able to speak with one voice to the government, and we are all united. So you can be assured that unity collaboration will not just end here. Okay, it's being reflected right at grassroots level. We are also CHAM, the two religious bodies, like in Malawi, we have the Protestants and the Catholics. They're also stretching out even to others whom may not necessarily be part of CHAM, but CHAM reaches them out to them too, and they're also able to present their issues on to government, because government recognizes CHAM, which really belongs to the two religious bodies. So I would say that even through CHAM, that has also provided collaboration and even greater working relationship, connecting government and what the faith community are doing, faith community interventions, health interventions on the ground. I hope I've done justice to that. Thank you.
Yeah, thank you for the journalist who asked this important question on procurement of medicine. and also how do we collaborate with other sectors. In Tanzania, as an example, and I know even other countries, including Kenya and Uganda, I think they went also very well with that, because we have a lot of hospitals and dispensaries and health centers. And so procurement is a very important issue to be in transparency and other things. Now, we are working with the governments because they are supplying medicine in the hospitals, and with a good price and quality, and sometimes we are getting also a subsidize from that medical store in Tanzania. But again, not only working with the government, but also with the Africa CDCs, and we have drug supply organizations, and we are collaborating with all these. And recently we found that it is a high time for we church or faith-based hospitals to have a business on that, not for profit, but also to have a quality drugs, because people are trusting us, and we have also to make sure that we are really doing that. May I welcome our colleagues from Christian Social Service, an ecumenical body where the Protestant and the Catholics in Tanzania, we are joining effort in education and health. Maybe you can also add, because we are in the process now to start, with your permission, if you can add in 2 minutes, please.
My name is Peter Maduke. I'm Executive Director of Christian Social Service Commission. In terms of a pool procurement, particularly we're also doing for the East Africa community through EPN. We are in discussion on the matter, Kenya, Uganda, Burundi, Rwanda, so that we can buy or procure medicine and other commodities together. So we reduce the cost of the medicines and also be able to get quality medicine. But in addition to that, particularly in Tanzania, we do also pool procurement for our facilities to be able to collect, to do the projection, and also order in a big volume so you can negotiate even the price. So that's but I want to add one thing when it comes to self-sustaining. Actually, we are now in our facilities, we are creating a business mind in running our facilities. In addition to that, in Tanzania, we have taken an approach which we call market-based approach, whereby the facilities will concentrate on the area of the demand driven, but also introduce medical projects. Those who can pay will pay more by having these VIP services, so that those who can pay more, they will pay for those who do not have money or they cannot pay. So thank you. I know the short.
Thank you very much. We are going to take the last round of questions. If there's any other burning question from the floor, from online, I see one there. Let's see how many more want to ask question. Then we take that one. Kindly stand and mention your name.
Good afternoon. My name is Vundi. I'm writing for The Elephant and the Mount Kenya Times Global Affairs. So my question is, given that the church network has often represented the only trusted presence in areas that are abandoned by state forces and international and governmental organizations, what is the specific high-risk operational steps that these African faith leaders and the member organization of economical organization are taking to leverage the unique moral authority when it comes to negotiating and enforcing health ceasefires as safe corridors with armed non-state actors, and then also the protection of faith-based health workers and infrastructure when it comes to international humanitarian laws, which is routinely ignored. And the last is ensuring the moral authority translating into a concrete, immediate humanitarian response that crosses volatile front lines rather than primary remaining an appeal to external governments. Thank you.
Thank you. Thank you very much for that question. Any other last question before we close? We close with this one. There's a mic behind you.
I understand that there are discussions around local manufacturing. Are you involved in any way? Or probably do you plan to join that discussion?
Thank you. Thank you very much. And I'm going to invite our panelists before I request ACHAP to answer the question on local manufacturing. But we've heard from Nigeria, and Bishop Kukah can share, especially knowing the context of Nigeria, especially on that question on how the specific risks that they are asking in terms of health delivery, especially looking at the context of Nigeria. I'll invite Mkandawire to answer the question on local manufacturing, and also now the other bishops, the Bishop Malalusa and Reverend Francis also, they can respond to the issues of an ecumenical engagement. Bishop, we start with you.
Please, you understand that local manufacturing is more profitable, so you don't want Nigeria to. The gentleman from the elephant, is it? Your question suggests that you're very well informed. But I'd rather speak briefly on the issue of the church's involvement with mending the brokenness of Africa, which speaks to us in some of the things that you've raised. We are very much on the front line. In Nigeria, I'm the convener of the National Peace Committee, which tries to, it actually grew out of the experience in Kenya after the elections of 2014, or was it 2013, 2014. And since then, we've been trying, I don't want to say without much success, because, you know, the African politicians are a pretty stubborn breed. But we've tried to, you know, deal with issues of giving a sense of moral direction to where politics really ought to be. But the scope of the brokenness of Africa is such that it's not just about moral authority. My country is a poster child of the disaster that has now afflicted the continent. Our situation is worsened by the fact that we are perhaps the crime scene for the things that happened in Libya when after the footprints of the United States of America, after Libya, where most of all these characters descended on the Sahel and have ended up in Nigeria. We're still battling rather unsuccessfully, I must say. We're trying to contain them. But when it comes to the rules of the church, all we have is a moral voice. We don't have, we still remember the words of Joseph Stalin, who asked how many divisions has the Pope. So there are challenges. Nigeria has a Ministry for Humanitarian Affairs, which is supposed to take care. We also have a National Emergency Agency that on paper is supposed to alleviate the massive sufferings of people who are displaced by all these endless crises. But as you know, the bureaucracy in Nigeria and the bureaucracies in Africa are literally dens of corruption. A lot of the services don't actually end up reaching the people. So it's a pretty tough call. But I think that perhaps one of the things we should also be trying to encourage our people is to appreciate the fact that there's no alternative to democracy, not with all its imperfections. I'm happy that your country is relatively calm, because I've been a student of Kenya for a very long time. For some reason, I had a lot of interest in your politics. But I make the point that with all the frustrations, there are no other alternative systems that can guarantee us the capacity to manage our very many diversities. So we encourage our people to still remain hopeful, because we have a duty, and the growth is not so easily discernible, but we're making a little bit of progress here and there. The temptations for military solutions, as you can see, we're just talking about Guinea now. All of these options will always end up providing a cure that is worse than the disease. That's what the military does across Africa. You've been very lucky in Kenya that they haven't had the temptation, you know. But as I said, I think that our role is to continue to encourage our people. Democracy looks like it isn't working, but at least it's a tough job. The Americans have been on it for over 200 years. They're still having. So it's not an easy fix solution to our problem, but I'm convinced that it provides us one of the best platforms for managing our complex diversities. It seems to aggregate the interests of the tiny political elite whose patterns of consumption are destructive. But still, we must continue to encourage our people to choose wisely. And then, as I said, finally, it's for the church, because I think that, you know, I've been, let me say, in this business for a pretty long time. And my experience right across Africa is that we are still standing on the edge of the river, unsure whether to enter or not to enter. So we are still unsure about the quality of politics and politicking. And I think we really need to sharpen the tools of engagement, you know, with our politicians. We're not doing that well enough. We have to continue to encourage them beyond just, as they say, speaking truth to power. We need to also get some of the good people, especially in civil society, to throw their hats in the ring, because very often people think that the business of civil society, I was involved with civil society in Nigeria through the very difficult period, you know, the Abacha years, as we call them. But once democracy returned, civil society simply froze and believed that their job had been done. So I think we must understand that agitation is not enough. We must also try and find some of our good people to find seats at the table. Because as they say, if you're not at the table, you're at the menu. So I think this is really the challenge that I think we should try and encourage our people to do what needs to be done correctly. Thank you very much.
Thank you. Thank you. Thank you. And we need to claim the seat at the table. I'm going to request Reverend Jane from EPN, Ecumenical Pharmaceutical Network. She's going to answer the question on local manufacturing. Welcome, Reverend Jane.
Thank you very much for that question. And I'll just mention some of the initiatives that Ecumenical Pharmaceutical Network is undertaking together with the members to address local manufacturing. One of the main involvements has been around regulatory harmonization. And this has been an initiative with AUDA NEPAD, because they are the forefront in negotiating around local manufacturing agenda. So there has been a lot of involvement with the members also at EPN level, just ensuring that there is harmonization in country as far as local manufacturing is concerned. Then there has also been, for example, in Kenya, has developed a local manufacturing strategy, just being part of the conversation, informing the local manufacturing strategy, so that it also informs some of the ideas that are coming from the church health system in as far as local manufacturing is concerned. And then the other effort also has been around encouraging our members to identify areas that they can, you know, manufacture. And I know I've had conversations with a few of the teams here talking about some of the, you know, plans or processes that are they're undertaking to ensure that they are already prepared to engage in local manufacturing agenda. Then there has also been the conversation around technology transfer. And you recall they just concluded the G20 meeting in South Africa, that one of the main agendas was around local manufacturing. And we were also heavily involved in informing some of the call to actions, so that the issue of technology transfer becomes, you know, real transfer, and not having companies coming from, you know, the West to establish, you know, establishments here, but really ensuring that it's technology transfer which is at the center of it. So those are some of the initiatives that are happening. but I know there is much more that our members are undertaking. Thank you.
Thank you. Thank you very much, Reverend Jane. And finally, in terms of ecumenical engagement and responses in health service delivery, when in terms of humanitarian crisis, Reverend Francis Mkandawire will respond to that. And Archbishop, if you have wisdom to share with on how you respond, especially when it comes to responding when there's humanitarian health crisis, as asked by our journalists from the Elephant Media. We start with Reverend Francis.
I would say thank you so much for the question. I think we need to look at as faith, as FBOs, faith people, we need to look at two levels. One is the whole aspect of prevention. I think we need to actively, in other words, be proactive in the area of prevention, rather than just be like an ambulance when there's a crisis. We need to always be proactive to ensure that these things don't happen. And I think that's very important, whether it be political issues in terms of engagement with politicians, peace building and conflict management. As in Malawi, we have a faith group, which we call Public Affairs Committee, which is, and of course we have our Archbishop here, who has been the chair of the mediation team, making sure that our politicians are behaving and avoid unnecessary crashes and all that. And that has helped us a lot in terms of to just avoid us getting to, the issues degenerating into a crisis. But where there's that crisis has taken place, I think it's important, especially through our ecumenical cooperation, to get involved, because we are the first respondents on the ground. Being faith-based groups, were always on the ground, and people they would rather rush to our structures before even they rush to government. So I think it's important that we are actively, in other words, we are our capacity is developed, and that we have to see how best we can work closely with government in our nations. And for instance, recently in Malawi, we had the floods about 2 or so years ago, and over 1,000 people died. And government, they have a department which works on disasters, engaged our CHAM, our health, Christian Health Association, and our various denominations. The Catholics, the Protestants were working together in terms of trying to reach out, even before government was on the ground. And one thing we learned is, I think we need always to have a rapid response structure in place. Always, we must be ready for such crisis. Sometimes we take time to respond. I would want possibly some of our colleagues, especially in areas of conflicts, possibly can you can. Yes. Fine. Just to have possible feedback on that. Thank you.
Thank you very much. And Archbishop Malalusa.
Yeah, it's more or less the same as my brother Mkandawire shared here on how do we work ecumenically and how we really we are involved in communically in humanitarian response. In Tanzania, it has been a culture now that faith leaders are meeting together and discussing, especially when they see there is a danger ahead. And this was started by the founder of the nation, Mwalimu Julius Nyerere, the first president, So we had a culture of meeting with politicians. And I'm saying this because of what has happened recently in Tanzania, and what has also happened here in this soil, that sometimes, especially in the politics, there are a lot of conflicts are starting, emerging from there. So we as a faith leader, we see that we are obliged, and it's important for us to meet with the politicians. Don't leave alone. Otherwise, solving the problem could be really a big issue. But we have been doing the same, as Mkandawire says, when we got drought or pandemic. Faith leaders, especially Christian church, church leaders or faith leaders, are very much in front on helping to calm the situation, and we are proud of that, especially when we were suffering with COVID-19. Faith leader were in front to encourage people for vaccination, and even if we could differ with the politicians, but faith leader were encouraging people and even teaching how to respond with that pandemic. So I could only contribute on that. Thank you very much.
Thank you very much, Archbishop. And the last question is from our online participant. And this is a question directed to the youth. And you can see in our panel here, we have a youth representative. And this is being asked by a journalist from the US who is online. And the question is, what would you tell other youth about this consultation? Do you have faith that other religious leaders will engage the younger generation to make health decisions that are good for young people? What is your objective after this? Over to you, Joyce. These are tough questions asking, especially for the young people. Come and respond.
All right. First of all, thank you so much for giving the young people a platform, the youth, a platform to be part of the conversations in the room. We thank you for the representation. I would start by saying yes, faith leaders have the youth at heart. It's for one of those causes that we have some youth in the room represented. For the main objective, for me, looking at the current challenges of my fellow young people, principally, I would start with conversations, storytelling, and having the youth speak up. In the statement of unity, one of the things we mentioned is that as the youth face these challenges with everything that is happening, the digital upgrade that is happening, there is a lot of isolation and despair. When you speak to some young people, they feel tired. They're like, you know what, let things go. Natural selection will happen, our time will come. Which, if you listen to that statement very well, there is despair behind it. It's not a statement of there is despair, but there is hope for the young people, and the needs of the young people are being addressed. When you look through the statement of unity, you will see that the conversations came up and the young people are involved in this. That's why we are here. There are a lot of young people in the room. And so, yes, we will speak up. We will start the conversations. The conversations will go on, because when we speak up, then we can talk about the challenges. When we talk about the challenges, we can develop the solutions from our perspective as young people, from our perspective for the things that press us the most. Thank you.
Thank you. Thank you very much, Joyce, for speaking on behalf of the young people in the continent. And we appreciate that. You can see it's a commitment that they allowed the panelists also to have a young voice and also a woman. For us, we're promoting gender equality. And we are really, really grateful. Religious leaders gathered here. We appreciate that you endorsed her and you accepted that she speaks on your behalf and representing the young people. So, Your Excellencies, Your Eminences, distinguished members of the press, we've come to the end of our press conference. And before we close, I know the press would want to pull aside some of the religious leaders for a one-to-one question. I would want to introduce them to you and to ask them to stand based on the countries. All the representatives from Cameroon, please stand. If you have a specific question for Cameroon, you see the people you're going to see Cameroon, please stand up. So those are the religious leaders from the Cameroon. So members of the press, if you want to pull them aside and ask them those tough questions from Cameroon, those are the team to pull. Then we have Democratic Republic of Congo, DRC. DRC is well represented. We have those four. So feel free to have a one-on-one with them, followed by Ghana. Ghana, they are well represented. You can see them, the representative from Ghana. Then we have Kenya. Kenya, they are there. They are well represented there. We have the Deputy General Secretary from NCCK, from EPN, and from KCCB. They are well represented there. Then we have Nigeria, read by our panelists. You can stand so that you are leading. Okay. Yes, they started the Nigerians. So thank you very much, Nigeria. So this is the team from Nigeria. Press, if you have some specific questions on Nigeria, these are the people to see. Then we have Malawi, represented by our panelist here. Malawi, please stand. So that is the Malawi delegation. Malawi. So those are the representative from Malawi. Then we have Rwanda. Well, Rwanda, they are there, led by Archbishop Laurent Banda. Then we have Uganda. Uganda, well represented there. Then Tanzania, led by our Archbishop. The Tanzanian delegation is there. And finally, Zambia. Yeah, Zambia. So that is the delegation from the Zambia. So with those few remarks, we bring to a close our press conference, and we are going to ask Archbishop Laurent Banda to give us the closing prayer. Archbishop, welcome.
Can we all stand, please, for prayer? Let us pray together. Our gracious Father, we want to give you praise. We want to thank you for this day of Thanksgiving. We also want to thank you for the work that has been done. We thank you for our panelists, for their contribution. Father, we take this statement and we give it to you for your use as you see fit. We also pray that our voices will be heard in different places, especially in the different governments that we represent, but also among partners that want to come alongside. We don't need the fathers, we need the brothers and the sisters that can come alongside, that we can hold hands together and move together to address the issues that face us. Give us wisdom and give us insights as we seek ways of addressing our issues on the continent and finding solutions that are from our own prospective countries that can address the needs of our people, and Father, that we can also collaborate and share our resources on the continent, inspire and spur each other to love and to do good works. We pray that as we dismiss, that Father, you bless each one of us.
You are a God of love. You are a God of peace. May the peace that surpasses all understanding guard our hearts and our minds. Help us to look to you in the hope of your return, but also in the love and knowledge of God and the love of your Son, Jesus Christ, our Savior. May the blessing of the Almighty God, the Father, the Son, and the Holy Spirit be with us, be in our families, in our countries, accompany us now and forever. Amen. Thank you very much.
Thank you. You are all invited for lunch. Lunch is served outside.